Hey there, clinicians. My name is Omni Kitts Ferrara, and I am the Director of Education with INELDA, the International End-of-Life Doula Association. And today I want to talk to you about the positive impact that end-of-life doulas can have with you in clinical settings and as a tool to be able to refer your patients to this resource. A little background about me. I am a proud birth doula and end-of-life doula. I am also a nurse, so I have that wonderful intersection of both clinical understanding and also community-centered doula work. So let's dig into it. I'm going to share my screen and have a little time, hopefully about 20 minutes, just to give you some awareness of how long this will take, but about 20 minutes to go through this presentation with you. So we hear clinicians out there in the field kind of saying, what is an end-of-life doula? Even what is a birth doula? And I think part of our job as doulas is to really be able to speak our impact to you so that we become a resource that you trust and count on. So we're going to go through that in this presentation. First and foremost, who is INELDA? So we are one of the largest and oldest end-of-life doula training organizations in the nation. We have trained upwards of 8,000 end-of-life doulas and 43 different countries. So we have this global reach, and we have really just been in the conversation of end-of-life doula work since 2015. We are a member-based nonprofit organization, and we are dedicated to addressing the non-medical needs of the dying. So we do that in a few ways. We offer end-of-life doula training for individuals worldwide. We have doula trainings specific to hospice and care providing facilities. And then we support those practicing doulas in the spectrum of end-of-life care. We have collaborated with hospices nationwide. We are working at the state level. We are working at the national level to be able to really bring doulas into the healthcare delivery system and hopefully to be integrated into interdisciplinary teams with more ease. This is our team here at INELDA, and I think it's really important for us to always show you this because it isn't just, me who is sitting here telling you what I think. Everything that we present has come from a larger conversation of all of these individuals who have backgrounds from chaplaincy, social work, nursing, education, you name it, we are doing it. And so all of our voices come together to be able to provide the material and the lived wisdom and experience that I am going to share with you today. On top of that, we have incredible rich membership, and those members provide feedback, our learners provide feedback, and we are listening. What is an end-of-life doula? This is the most common question we hear from clinicians. So INELDA defines, and really this is a very broad and widely used definition at this point because we have been in this space for a long time. But an end-of-life doula is a non-medical person who accompanies, educates, and advocates for those in their circle of care who are planning for death, diagnosed with terminal illness, or facing imminent death. Doulas also support people and communities who have experienced a sudden death. So even in this definition, you can hear that doulas can be used in a very vast spectrum, right? We call sometimes like the continuum of care. Well, doulas can walk with patients, with people, really through their experience of end of life. And that doesn't always begin when we are facing terminal illness. It can begin much farther upstream. And so you will see doulas working within palliative care, out there in their communities, educating for advanced care directives and the benefits of having them. So they are really boots on the ground, care providing partners. that I think as clinicians, if you know they're there, hopefully you will refer to them to support people and to also unburden yourself to give, share the load of how we can support folks. So doulas can support relational autonomy and person-driven care. We center around them. We see them as the driver of the process. And so we are working as doulas just to really listen to the preferences on all levels and be able to communicate that although we will not discuss or decide any medical, decisions, we just are the one who sort of listens. We may write it down. We may be able to just remind folks of what this person is hoping for. Doulas also increase the workforce. And as a nurse myself, I know how important it is when I have a nurse tech or aide. I rely on that beautiful teamwork. I lean into my social workers, my chaplains, my charge nurse, my providers. I am always leaning into the spaces there. And because we know that we have a burdened healthcare system, I want you to know that doulas are paraprofessionals that you can absolutely draw in to be able to provide emotional well-being and support, really just presence when patients need someone to sit with them and listen to them. So they increase the workforce. They aid in the prevention of aggressive care because they are also talking about advanced care directives and those decisions at end of life. And if that work can be done ahead of time, then we don't have those moments of crisis or less moments of crisis, hopefully, because those conversations have already been had farther upstream. So really thinking about doulas, and one of the positive impacts is that they'll help to unburden the healthcare system, and they'll also prevent aggressive care at end of life, which absolutely affects the bottom line and cost. It is important to know what doulas do and what they do not. We spend a lot of time with our doulas and our trainings to be able to say, like, this is your role. This is not your role. And for me, as a birth doula for a long time, this is one of the places that I hear clinicians and nursing staff and, different folks kind of feeling like there's a little bit of this tug between, is that your role? Is that my role? And just very transparently, I think we can say that there is overlap. There is overlap. But where it does not overlap is doulas are not providing medical medicines. I'll use those words. They're not providing medicines. They're not giving advice. They're not talking about any of those things. They're not trying to get them to make decisions about it. They are holding the space for conversation, and they are really asking their folks, like, do you have questions? Let me write those down for you. So when your doctor comes in, you have a list and then you can ask that. So they're in a facilitator role. They are not in a decision-making role. We do companion them, we listen, we help to reprocess. So if a big change in their prognosis was just delivered, when the providers leave, doulas can be there to say, that might have been a lot, how are you feeling? And giving them space to just kind of debrief and settle into the next big change that has come forward. So all of these are methods that we can do. And within interdisciplinary teams, doulas have to be really good at communicating and understanding their resources. So in our hospice specific training, we train our doulas to be able to communicate. Is this something that we need to get to our volunteer coordinator in a quick matter? Do they need their social worker? Do they need their nurse? Do they need their chaplain? And so we really work to just, again, hear and listen for the needs and then communicate to the appropriate person. What's the positive impact of doulas? Well, there are many. as birth doulas, we can say, we improve birth outcomes. In death, in end of life, we can't say that we stave off death, we take away death, right? And so it feels a little harder. It's like, well, what is the benefit if we're not saving lives? Because that is so much of what we learn as clinicians is like save lives, avoid death. And so this has just a different filter. It has a different lean. But I think as a nurse and a doula, doulas will increase patient encounters. This is a huge impact. So when nurses are, burdened, we have high workloads, caseloads, when we have a lot of stuff to do, but we know that that patient needs someone to sit and listen to them, get the doula in there. Call the doula, right? Hey, I think this patient would benefit from a doula. They're just going to sit and talk and be able to hold space with them. We have the possibility, if we are received well within the clinical sphere, doulas can be a through line with a patient. So I hear clinicians say oftentimes from palliative care to hospice, when the hospice team comes in, they're really regarded as the bad guy because, the palliative care is helping to increase quality of life even when they are living with serious illness, life-limiting illness. But then once hospice gets there, it's like, oh no, everyone's given up on me and here I am now and I'm dying. Doulas, if they're integrated in palliative care, they can be having discussions of what is expected, where we could possibly going. And they become this through line to work with the patient from palliative care to hospice and even into bereavement. So I really want to emphasize that if they are used, if they are activated, if they are referred, by clinicians, then you have someone who walks alongside this patient, and this will increase and improve our survey scores, right? This will impact those families in more positive ways. So these are big measurables, encounters and survey scores. These are big ways in which we can positively impact. The other thing that we are doing is educating. We are telling them about advanced care directives. And so we absolutely support informed consent. Do you have all the information you need to make a decision? Are there more questions, And as a nurse, I work with doulas and I work really hard to get the doulas to not be adversarial with the providers and the clinical team. So I don't want them saying like, they have a lot of questions and you haven't answered them. No, there's a way in which we can effectively communicate for the best outcome of the person and their circle of care. And finally, there's a lot on this slide, but what I will say is if we are integrated well, we can help decrease burnout, right? Direct caregiving is a lot for, whoever that person's direct care provider is, but then also for the nursing staff, for the clinical staff. Like if we are in there, we may offset some of the workload. And I think that's huge because as a nurse, I know I would love an extra hand in there to be able to provide the best possible care, but I am only one person. And so workforce. As clinicians, I know we rely on our research, and so I won't spend too much time on this slide, but I will say that I will include a PDF with the links. And if you want to start researching about the positive impact of end-of-life doulas, please. Funding options for death doulas. These are questions that come up, like how do we pay for them? And so these are just some of the most obvious or generally used ways in which death doulas are paid for. Number one, it is oftentimes a voluntary service. So they are the volunteers of the hospital that are trained additionally. They are given particular spaces or access to be able to give that care or to help with patient navigation. And so volunteer doulas are a huge way in which we see this. We also see a portion of death doulas in a work for payment or pay for service model. A great example of this is at UPMC McGee Women's Health Center in Pittsburgh. They have an integrated birth doula model, but they have a a workforce of 40 plus doulas, and they are paid, and they do everything from telemedicine or telehealth, excuse me, visits where they can confer with the person all the way out throughout the spectrum. And then they are also activated during labor. And so the sort of parallel to labor in end of life doulas is end of life, right? That vigil sitting or 11th hour sitting, imminent death. You can activate death doulas to sit and to be with that family to really help support them. I think we can get creative too, finding funding that could be sourced from prevention and public health funds, and really looking into how financing end of life support will have implications, right? System change, and really help people on a bigger level. This is a great quote, and it kind of says, like, on any level, whether we have those end-of-life doulas integrated in a clinical space or in a community-based space, they are helpful. This is desirable, and it can lead to cost savings. So what are the major drivers of cost savings? We know that if someone at end of life is hospitalized and they are receiving aggressive care, cost goes up. So when patients have used palliative care, we see costs go down, we see aggressive treatments go down. Well, if we have doulas in that space, educating, advocating, having conversations, supporting them, we are going to have less use of aggressive treatments. And for even within the hospice model, if a doula is assigned to a family and their dying person is experiencing a bit of crisis, they can be there to have a conversation where they triage, like, do we need to go to the ER? Because if we go to the ER, what happens, right? We kind of have to restart the whole hospice process in general. So we get those live discharges, and that also burdens the system. So if you had another person that they could reach, and that they could just have those conversations where they could advocate and educate and say, hey, let's use the systems we have in place. Let's call that nurse. Let's take some big breaths. Let's do what we can do, right? And that will help the live discharges, and again, lower cost and get greater utilization of these systems in place. Best practices for integrating doulas into interdisciplinary teams. So these are bullet points, and I am going to send with this presentation a PDF where all of these are expanded upon. But we have done a nationwide, working with different hospices and care providing facilities across the United States. We have partnerships with them. And so we asked them to come into a think tank, and we asked them a lot of questions. And the ones that we invited in are ones who are actively integrating doulas. And we wanted to hear everything, like what works, what doesn't work, what are the challenges. And so what we have pulled together is basically some best practices that we have gleaned from them and that we know about the field of end-of-life doula care. And we have recommendations. And so I'd love for you to check that out. And then finally, I really think we have to do this together. So I will stop my share for just a moment to say, even if you do not have integrated end-of-life doulas, as clinicians, you have so much power to be able to say, I'd love to see this happen. And when those doulas get there, if it comes from the top down, if it comes from providers, and you're saying these are incredible assets to our team, we have deeper integration, and then we have better patient outcomes. And finally, if you do not have end-of-life doulas within your system yet, think about the community-based doulas that are out there. So at INELDA.org, that's our website, INELDA.org, you can go to our doula directory and just like search your area and have a resource list of community-based end-of-life doulas. So even if they are not integrated into your system, it's an incredible referral that you can make to be able to support people out there to make informed decisions, to lower aggressive treatment at end of life. And we know that that is also delivered inequitably, right? So aggressive treatments, we see this in our BIPOC populations just the same as we see it in the delivery of healthcare, we see it in the delivery of death care. And so all of this is work we know is important. And so together, I think just know that you have end-of-life doulas out there in the field waiting to support you as clinicians. And then also, of course, people who are facing end of life. So thank you so much for your time. If you have any questions at all, please do not hesitate to reach out to me. My name again is Omni, and you can just write my name, OMNI, at INELDA.org, and feel free to reach out. I'm happy to discuss, to dream, and to help you refer and resource with end-of-life doulas. Thanks so much.